Hello, my name is Julia Ebbens and I'm a health content editor at Bupa. This is the second in a three-part series about how to make and sustain a healthy change. Again, I'll be joined by Sarah Griffiths, a behaviour change expert. Hi Sarah.
Hi Julia.
And Julieta Correa, a health advisor at Bupa.
Hi Julia.
So previously we talked about the stages of change, the initial process of considering and also planning for change, and most importantly, how to get started. This time we'll be discussing how to maintain a change, which is where I think a lot of us struggle. Sarah, can you please remind us of how this phase fits into the overall stages of change model, please?
Yeah, sure. So the model shows how people typically move through a number of stages to reach long-term behaviour change. And the first three phases are pre-contemplation, contemplation and preparation, where people move from realising that change is needed and then thinking more about how to actually make those changes. And then the fourth and fifth stages are action and maintenance, so where changes are actually made. And maintenance is an important step because it can be really easy to relapse, especially in those early days before reaching long-term change, or you can even move back to one of the earlier stages.
It must be really frustrating if you feel like you're moving backwards instead of forwards. But I think we can all relate to that. Julieta, do you have any first-hand experience of people who have gone backwards, so to speak, and maybe felt a bit demoralised that they weren't able to maintain the change?
Yes, and it is common. It's something important that we need to bring to our assessment when we first see our clients, not letting them fall further back or feeling further demotivated to a pre-contemplation stage. Understanding what went well, what was difficult to maintain is most definitely a step forward, as well as re-evaluating the goals previously agreed and reassessing current readiness for change. So we often see this in clients that want to lose weight, and for various reasons, from going for a longer holiday or dropping motivational levels, they have regained that lost weight. So looking at what didn't work and focusing and moving forward is important from our side. And I believe our clients feel well supported in doing so.
Yeah, that support sounds really crucial because when you're going it alone, it's actually really hard to motivate yourself again when you've had a setback. So, Sarah, what would you say to someone who is struggling to maintain a change? Because I think it's quite easy for us to blame ourselves and we might just feel, we're lacking a bit of willpower. But I think there's more to maintaining change than that, isn't there?
Yeah, definitely. It can be really tricky. So you're not alone if you struggle to maintain healthy changes. I think it's really natural to start off strong, full of enthusiasm, and then gradually feel as if you've hit a wall or you're just simply unable to sustain the changes that you've started to make. And part of the model that we're talking about shows that behaviour doesn't always follow a neat path. I think we all know people are very complex. We all have individual circumstances and challenges, and relapse can occur at any point in the process. But I think this is a great time to identify any potential barriers that might be preventing you from making a long-term behaviour change. Or it might be that you actually need some additional support to help you to fully establish a new habit.
Definitely. What type of barriers might prevent people from making change, do you think?
So I think something that's really common is wanting to change too many things at once. So it could be that you want to exercise more, tackle your diet and improve your sleep. So obviously that's quite a lot to try and change all at once. And it can be quite overwhelming trying to do all these things. So it's often better to choose one area and then maybe focus on a behaviour to help you with that until you're confident with that change before making another one. And some behaviours are also really deep-rooted. So things like smoking might be something that you've done for many, many years. If you see yourself as a smoker and people that you socialise with, they're also smokers, it can also be hard to consider changing that.
So do you think some behaviours are probably easier to change than others?
Yeah, definitely. I mean, if you look at something like drinking more water, then that's going to be a bit easier to sort of fit into your daily routine. But it can also be that you've been told to change your behaviour. So rather than it being your decision, if you're trying to change something based on what other people have told you will be in your best interest, then that can be an extra challenge. And this can lead to being a bit stuck in that pre-contemplation and contemplation stage. So moving between thinking that you need to change, but also not really wanting to or not understanding quite why it's needed. And then I think another barrier that prevents change can be feeling like life's just too busy, that you don't have the capacity to try and tackle something else. And it can be really hard to think about additional things if you already feel like you're short of time and energy. And again, this is where additional support can be really beneficial.
Yeah, that makes a lot of sense. Julieta, do your clients ever share any specific reasons they might be unable to sustain a health change?
They do actually, and we look at options together. 2 frequent reasons are lack of time, which I believe we all relate to, while managing a full-time job and children, etc., and part of their personal life, leaving them with less time to exercise and cook healthy meals, or simply having had an injury or limited movements that will force them to stop exercising as they were before.
So now we've discussed the type of barriers that can affect our ability to reach our health goals. In your opinion, Sarah, what is the key to better outcomes when trying to make a change?
I think we all know really that planning can be an important part of behaviour change. So thinking of potential barriers that could knock you off course, how you might deal with those, that can be really helpful. But being in the contemplation stage for too long can actually lead to doubts about the need for change and lead to loss of confidence. And this can even move a person back into pre-contemplation stage as well. I think we also know that people who are already making a change, even really small changes, are more likely to have better outcomes. So making a small change is a positive first step, and it can lead to bigger changes. Sometimes you just have to bite the bullet and just go for it, especially if you've thought about possible barriers that you might face along the way.
That sounds really useful. I think a lot of people don't consider what barriers they might encounter, and therefore they're surprised when they actually happen. So that sounds like a good tip.
Yeah, exactly. Other tips would be to start small. So if you want to stop smoking, it can be good to have a quit date, but you can break that down. So aiming for a day without smoking as that first step, then 2 days, 3 days, a week, 2 weeks, and so on. Or if your overall goal is quite broad, like getting fit or improving your diet, you could try to choose a specific and realistic behaviour that will help you to get there. And also, I think this is really important, is to identify something that you actually enjoy doing. So that could be running, gardening, walking, swimming, something that you've done before that you've actually enjoyed. So your target behaviour could be walking 3 times a week for 20 minutes. And then once you've achieved this goal, you could look to increase the frequency. And if you want to increase the intensity, you could add in a 5-minute run to the walk and then build up from there.
I think it's really important you pointed out that you need to enjoy what you're doing, because that is key to success, in my opinion. Yeah. It sounds like you were also referring to SMART goals, which I know we discussed before. Is this stage a good time to maybe check in again with these and possibly tweak them if necessary?
Yeah, exactly. So revisit your goals and make sure they're still working for you. Just as a reminder, that's making your goals specific, measurable, achievable, relevant, and timely. So you can define your goals and check in with them. If you're doing really well, then you might want to level up before you get bored and lose interest and motivation. And equally, if you find that it's not working or it's not fitting into your routine quite as you'd hoped, then reducing the intensity or the duration might be needed at first.
Yeah, so just making them realistic, basically.
Yeah.
And is there anything to be said for rewarding ourselves for any progress that we do make?
I think there can be a place for rewards to reinforce the positive changes that you're making. So that positive reinforcement can really help us with motivation, particularly in those early days when changing your behaviour feels like hard work. You know that you're going to get something back. But I'd say there are a couple of caveats to this. So the first would be to consider the type of reward. So if you're changing your diet, then rewarding yourself with food after having a good day or looking forward to a takeaway at the end of the week, it might make it hard to get back on track. So we're also telling ourselves that we've got through something difficult, but actually we want this to be our new normal, so something that we wouldn't usually reward ourselves for.
So it could be, for example, going to the cinema or doing another activity that doesn't really have any relation to food.
Yeah, exactly. And then the second point is that we tend to associate rewards after finishing something, but behaviour change doesn't really have an end point. So for example, maybe you want to reward yourself for losing weight that you've been looking to do for a long time. So you want to book a holiday, but then what happens after the holiday? So you might set a new goal, or you want to maintain where you are, but this could feel like starting again after having a break and make the chance of relapse a bit higher. So small rewards for reaching goals might be a better approach and more effective for maintaining change. So something like buying yourself a new pair of jeans for reaching a weight loss goal, and then planning your new goal or how to maintain the changes that you've already put in place. And also, I think social rewards can be really effective. So things like catching up with really good friends, telling them how you're doing, and they can sort of tell you how amazing you are.
Definitely, I think that's really motivating when people sort of celebrate your successes as well, so sounds good. Julieta, do you find that people trying to make change actually benefit from changing their environment in some way? So could be removing tempting foods from the kitchen, or even something like laying out your workout clothes the night before, things like that.
Yes, and often that's the case, really. Identifying the barriers each client faces, encourage them to reflect and plan what can facilitate new habits to take place. So removing triggers such as having unhealthy snacks at hand, avoiding eating while watching TV or while working on the computer, as some of us still do, and overcoming barriers such as leaving all the workout gear ready to wear in the morning next day are examples of changes in environments that facilitate change and habit forming.
It sounds so simple, like laying out your clothes, but actually when you wake up in the morning and you can't find what to wear, it can actually prevent you from working out altogether. So
yeah, I think this makes a lot of sense, as there's really good evidence behind the role of restructuring your environment. And just going back to the example of changing your diet. So this could mean like not going down certain aisles when you're in the supermarket to help you avoid buying those foods that you're trying to avoid, if that's possible, or shopping online from a list and really trying not to add in any extras. And with something like stopping smoking, this could be getting rid of any leftover packs of cigarettes or tobacco to make it harder to smoke when you have an urge, and also removing things like ashtrays and other reminders of smoking from the house.
Yeah, you mentioned earlier that some changes are harder to make than others. So would you say there are any warning signs that people need to look out for? For example, they might need some extra help. This could be if they're really struggling to stop smoking or stop drinking alcohol.
Yeah, so with smoking, you might feel like you can stop on your own and that you don't need any help. But if you find that you keep relapsing and you're finding it really hard to be smoke-free for a long period of time, or if you're struggling to get out of that contemplation stage where you want to make a change but you don't know how to, then it can be worth looking for additional support. And I think that's where your GP or local stop smoking service can provide support. And they can sometimes provide aids such as nicotine replacement therapy. And then with drinking alcohol, so if you feel like you're losing control of this, or that you're struggling to reduce how much you drink, or maybe other people have expressed concerns about your drinking, then I'd say again, contacting your GP can be the best place to start. They can recommend additional support. And this also applies for other habits that you feel that you're not in control of and are struggling to change or to address in some way. I think it's important to remember that some behaviours or deep-rooted issues may require professional support. And we would always advise that if you're struggling with psychological difficulties, and that can include addictive behaviours, then please seek help from a GP.
Julieta, do you have any additional tips or advice to share from your perspective?
In cases of addiction, where additional support is required, there are other means available that we encourage clients to consider. This could be a local support group to stop smoking, a GP supporting the steps required to quit drinking alcohol, or even having talking therapy sessions that will help forming healthier relationships with food in the presence of eating disorder. Our advice as health advisors, as well as the GPs who see our clients, provide not only this support, but also additional life coaching calls, which will allow us to follow up with the clients on the goals that we set up, as well as the advice given.
Perfect. Thank you both. So this concludes our second podcast. Next time we will address what to do when you have a setback or a relapse, as it's otherwise known, but also why you shouldn't feel bad or guilty if you do experience this when trying to make a healthy change. Thanks for listening and see you next time.